Yeah, I know. The crowd is thinning compared to earlier.
I can't even imagine tomorrow morning. Okay. Although it's a relatively small crowd, and we understand for all of a gazillion reasons why, we're going to go ahead and get started. And we also decided as a panel that we're not even going to introduce ourselves because by now you've heard most of these illustrious people speak, or it's easy to look up. So we're just going to jump into the middle of it. And I guess I'll jump into the middle of it by picking on your state of Florida, where I was not too long ago. And it's sort of getting into the, why are we fat? How is it global? And the hell of a mess that we're in. I was in West Palm Beach a few months ago, and one of those typical intersections where there are 4 lanes of street one way and 4 lanes of street another way, but no sidewalks, and I was at a red light, and as I looked up, there were 4 different pharmacy chains, all with drive-up windows. And it was that smack on the head moment where I thought, I get it. We're all fat. But God forbid if you need your insulin or your diabetes or your Lipitor or anything else, don't worry about getting out of the car. Drive on up and we'll just give you your medicine to treat the whatever. At that point, I had this crunching feeling that perhaps we've really lost the war. And what's dawned on me as we've spoken this last 48 hours or so is that the population attending a conference like this is the well-to-do, worried well, for most parts, Caucasian audience. And I worry that we are speaking to each other in language that we all understand, but at the end of the day, we all go home and what the hell has happened? So I'd like that to sort of open it all the way down. And I'm going to end with you, Adam, because I want you to talk about what you raised Friday night, which is the poverty issue in all of this. But I'll let you start by defending your state.
My state is indefensible. Colorado is the state to defend because they've got the lowest rate of obesity. But it is interesting what you say about the racial distribution, because just last week the CDC report for the racial frequencies of obesity came out. And the thing that struck me, I mean, we all know that African Americans and Mexican Americans have a much higher rate of obesity than Caucasians. But the lowest rate of any of those groups in the United States was in Washington, D.C. amongst Caucasians. It was only 9%. And Caucasians only represent about 15% of the population in Washington, D.C. So it must be a selection bias, going back to what Adam's saying. It's the people who actually live in the city of Washington itself, who are white, are probably Congress people and their aides, who are going to be educated, health-minded people, just like the folks attending this forum. And I think that's an interesting commentary on all this too.
Ron?
So I would just pick up on the comment you made, because I see this all the time at the Joslin Diabetes Center, where young people wait for an elevator to go up or down one floor. And they should know better. I mean, for sure they should know better. And I want to say that there are a lot of good examples where this could be encouraged. Just simple change in daily patterns of behavior really need to be encouraged. My wife was recently in the hospital for an orthopedic surgery procedure at a hospital in Boston, and they had the stairwell labeled free exercise equipment. And I thought it was so clever because it is free exercise equipment. And a lot of people, including myself, pay money to join a health club when, of course, it's also nice to walk up and down the stairs as much as you can. So I think that we need to change this very early on. And, of course, we're losing that battle in terms of the health benefits of fitness in large part in many places because everybody is so sedentary and we don't do even the least bit of activity. The drive-up window for the pharmacy, the elevator to go up and down one flight of stairs, and we need the couples in our neighborhood who will drive 4 houses to come over for dinner. I mean, it's just ridiculous, right? And we just have to try to get the mindset back that, being out there and moving is actually healthy and will actually partly reverse this trend. Even in underdeveloped countries, this has been.
You have an interesting vantage point as an attorney and a chef.
I think that I look forward to hearing what Adam has to say, and what Jay just mentioned about this. Really, this is really a social justice issue, absolutely. And the people being most impacted by it right now are the African American and Hispanic communities in our country. But I think they're really the canaries in the coal mine, because we know now, we have predictions of 80% overweight and obese by the year 2015. That's 5.5 years from now. We're already close to 70% in this country. So the white population is quickly catching up. I think also in rural areas, sometimes in the urban poor areas. Rather than racial demographics, I think what we're seeing is economic demographics, regardless of race. And we've started in those other populations. But to have a forum where we keep going back to personal responsibility, I think we're past that. I'm afraid that we're past that at this point. And until we change our federal policies around international trade policy, around certainly the way we subsidize agriculture, industrial agriculture, through our farm bill every 5 years, until those bigger issues change and we're not paying the true cost of food. As somebody said in an earlier session, a hamburger should be $18 at McDonald's, not $1. When you figure out all of the expenses related to healthcare, when you add all those things in, until we're really looking at these issues from a very large policy perspective, and until Congress stops being influenced by the almighty lobbying dollar, we really are not going to fix this problem.
David?
The thing that concerns me is that, for many of us, we grew up at a time, a number of decades ago, where our food environment was certainly not what it is today, where you didn't have fat, sugar, and salt on every corner. And we had the benefit of that, as children and, during our developmental stages. The concern I have is that our kids don't have the benefit of that. They're growing up constantly being bombarded with food cues and fat, sugar, and salt on every corner. And so we don't even fully understand the ramifications of these kids growing up in an environment.
Because we haven't seen the whole generation play out yet.
That's exactly correct. That's correct. But what are we saying? Let me come back at you for a second. Are you saying, this socioeconomic issue, is it, what's the underlying, driver here? Are we saying that their environment is different? Are we saying that people who are different socioeconomic have different values? Are we saying they don't have, you don't want to say they don't have the supercortical control to do that? What is it, right, that...
Can't it be all of them? And I'm serious. Let's talk about supercortical control. If we talk about maybe a rewiring of the brain, or the things you talked about earlier, that people who want to eat don't feel hunger, they think about food beyond what's in the immediate mouth, in their immediate bite, that is supercortical control. So can't there be overlays of all of those things you just mentioned?
There's no doubt that, if you're higher socioeconomic, right, especially if you're going to be on TV, or you're going to be a successful lawyer, higher socioeconomic, there are other societal pressures, that are on you, right?
Absolutely true.
That set social norms, right? So it doesn't mean you struggle. We don't struggle. I don't think higher socioeconomic struggle less than lower socioeconomic. Right? In fact, the torment and the result of this constant bombardment with fat, sugar, and salt and responding to our environment, I think it's not, the outward manifestations may be more evident, in the poor population. But I think a lot of people are struggling with this in their environment and aren't very happy across the socioeconomic spectrum.
Let me begin with a sweeping geopolitical statement, trying to explain some of the reasons. And I believe personally that the obesity epidemic globally is actually the dark phase, unintended consequence of globalization. And obesity is actually the cost of political stability in developing nations. Essentially, what we're providing developing nations with is an inexpensive diet of processed sugar and fat. What is the bottom billion going to be eating if they have $1 a day to spend on everything, including food? They're going to be eating pretty much sugar. So the economic mechanisms are extremely, extremely important. And I think this is the reason why people select the foods they do, not so much because of choice, but because they really do not have a choice. The choice has been removed from them through various economic mechanisms.
But Adam, then how do you take that philosophy and apply it to China and India, where in fact the affluent are getting...
That's very interesting. In developed societies, Vietnam, China, is going to be the affluent urban groups who are becoming overweight. Obesity rate is about 1 or 2%, so it's not really there yet. In middle-income places like Mexico, there is no socioeconomic gradient. In Arab lands, there does not seem to be a socioeconomic gradient. But the moment you get to the developed world, where people spend 10% of their income on food and not 50%, it reverses. So now it is the lower-income people in urban milieu who are getting obese. And what's interesting, it's always women. So I view obesity actually globally as a major problem of women's health. It's women and children, and interestingly enough, not men. So in Vietnam and China, it's women. In Sao Paulo, Brazil, it's still women. It's extremely interesting because then it has to do with reallocation of food resources within the family, food choices, and all the other factors we talk about. They come in, I suspect, after the economic factors, which are really paramount. If you don't have money, it doesn't matter what else you got.
So I was in Durban, South Africa, and I'm with a group of health workers, and I was observing what you just saw, and I said, what is it among the lower paid health workers? Why, what's accounting for the obesity? And my fellow doc said, it's KFC. As soon as they have discretionary income, they use the discretionary income and they go into KFC. So that's fine, that fits the model. Then I'm up in the northern province, at KwaZulu-Natal, and there is no KFC there, I can assure you. Right? And yet, the women there are, by certainly our measures, they're big, they're obese. Right? And so I was wondering, there's no KFC, what is it that's driving their... Right.
Understand that KFC is a metaphor, just like McDonald's is a metaphor. We say the Chinese are getting obese because they're going to McDonald's. Well, 3 billion Chinese do not go to McDonald's. It's a metaphor for the changing diet, and the diet changes in specific stages.
Right.
Soybean oil first, right? Then oils, then chicken, then pork, then beef. It's very predictable.
So in KwaZulu-Natal, if you look in
oil,
what it is, everyone has their version. It's vat cake, right? It's fried flour.
Oil.
And with honey.
Yep.
Right?
Sugar.
And that's how they put on weight. But understand, they want to be like that. There's a social norm there.
Because the children are not starving.
And they're healthy, and there is... it's very complicated.
Yes.
At a number of different levels.
Yes.
And I think it's also, just going back to, West Palm Beach, it's not just, it's not just lower socioeconomic that are obese. We know that.
Can you be an power if your populace is obese?
Not forever.
No.
Not unsustainable.
Forever. No.
That's why China's going to take over.
Absolutely.
But China's getting fat too?
Not as much as we
Not
are.
as quickly. Absolutely. As you may know, I specialize in school food reform. I'm a food systems consultant, and I work in school food reform. The National School Lunch Act in this country was passed in 1946 to address the issue of basically underfed, malnourished soldiers during World War II. We have now, they couldn't find enough soldiers, not only who had teeth, but couldn't meet the minimum weight requirement. In this current war, we've actually raised the weight requirement because we couldn't find soldiers who were thin enough to meet it.
And I know that there have been recruits who have applied for the job in Iraq, and they've been denied access to the military, sent to some kind of weight loss regimen, and then as soon as they drop the weight, then they can reapply. And I thought, what an odd thing to do. You want to give your life to your country, but you're too heavy, so you have to go lose weight to get healthy, and then you can go get shot again. There was something quite perverse about the whole thing. It's quite odd.
I think it's the biggest national security we face. It's the one we never talk about, but on a long-term basis, and maybe not that long. Maybe we're looking at 10 years.
Ron, you want to say something?
No, go on.
Sorry.
I mean, the diabetes experts are here, but I'm sure you've been to these panels, the last couple of days. You've heard the statistics, starting with the opening plenary, in which the CDC said in 2005 that of the children born in the year 2000, that 1/3 of the Caucasian children and 1/2 of the African American and Hispanic children will acquire type 2 diabetes during their lifetime, most before they reach adulthood, and that they have the shorter life expectancy than their parents for the first time in American history. Those are really frightening statistics. If you carry that to the extreme, how do we raise a national defense, a military, if everyone is too sick to enlist or to be drafted, for that matter?
Well, it's even worse, because if you think about the complications of diabetes, it used to be that the mean age that type 2 diabetes began was 55. Now it's moving down into the 30s, and we're seeing it in adolescence. So if it takes 20 years to develop complications and the mean age was 55, people were developing their complications at 5. If they're now developing it at age 16 or 18, and it still takes 20 years, they're going to be in their 30s, and we're going to have a tremendously disabled society as a consequence of this. It really is scary.
It's frightening.
Well,
go ahead.
I was just going to say, if you want to think about health impact of obesity, it's a lot more than diabetes. Obviously, Jay and I focus around the diabetes because that's our areas of specialty. But obviously, it's associated with a whole range of metabolic derangements and the metabolic syndrome, with hypertension, accelerated atherosclerosis, polycystic ovarian disease in women, changes in rates of neurodegenerative diseases, including Alzheimer's disease. Certain common cancers are more common in obese people. So obesity is really a big driver of a lot of other major health problems, all of which I agree with Jay. I think that what we're looking at in a certain way is almost the tip of the iceberg, because as you move all of this into younger populations, then the time window of exposure to both obesity, diabetes, insulin resistance, all of these metabolic derangements starts much younger. And because most of the complications are related to duration and severity, the duration is there even when you're just middle age.
Yep.
And if you're setting down the neural pathways early on, if they're there for a lifetime, and it's so hard to change those neural pathways without dramatically changing the environment.
Well, we can even... I'm sorry.
Go ahead. No, go ahead.
I was just going to say, we can even go back earlier in early years, because basically we know the intrauterine environment is actually programming some of these things later. So both experience in human populations where there's been food deprivation, such as in the end of World War II, and the Netherlands when there was a famine and people were restricted to 600 to 800 calories a day. Even pregnant women were restricted in terms of their caloric intake. They had small babies who later grew up to be both obese and diabetic and have other metabolic complications. And we can reproduce that in laboratory animals by food deprivation. So this programming may occur very early, and it may occur both by food deprivation and also potentially even by different nutritional status, not food deprivation, but obesity and different.
Let me react to it in a different way. We sometimes say that we like, and this is really because of our belief in the freedom of choice, like we choose. And if our freedom of choice is sometimes abrogated, we don't feel we have a choice, we say it's because we must be addicted. Let's take another look at this. What if people ate the foods they could afford? And then after 20 years of eating sugar and fat, yes, you can have physiological changes. I absolutely agree. And if a mother eats sugar and fat in pregnancy that she's been doing for 20 years, yes, you may have consequences on the second generation. But the economic mechanism is the one that drives those choices in the first place, and then they are established. This is what you are doing, but really isn't choice, it's economics yet again. So the freedom of choice may not be there.
Are we looking at it sort of a rule where lower socioeconomic people become obese, and then
Faster.
obese people don't climb as high on the socioeconomic ladder?
Yes.
So it becomes,
Yes.
it feeds into itself.
Absolutely right.
And so then how do you break that cycle? And this session really is about the global issue.
Well, that's the global issue, because once you have an obesity expressed in a population for the first time, like for example in Japan or Vietnam and China where there was never any obesity and now you see it, the question is there ever going to be any going back? or is it too late? Once you have it expressed in a population, can you ever have a completely slim population ever again? And I suspect perhaps not.
So Canada is a good laboratory. Canada has always felt second sister to the United States. You talk to a Canadian, when they come across the border, they walk into a supermarket, and they go, wow, there's 32 types of cereal. We don't have that in Canada. Canada has never, they eat at home traditionally.
In Quebec.
Right. And they would never eat between meals. Social norms, that was never the culture. And I think you're starting to see fat, sugar, and salt, Tim Hortons on every corner, the equivalent to Dunkin' Donuts. You're starting to see their restaurants starting to change. And it'll be very interesting to see whether Canada over the next decade or two is able to keep, the things that they admired about us are now their saving grace when it comes to public health. The lack of...
Yes. There's one more component I should mention in this context. There is a social gradient in Canada between obesity and incomes. It's stronger for women than for men, but generally it's flatter than the United States. Money isn't everything. And some people in Canada, rightly or wrongly, say because it's of the healthcare system. So that may be something that weakens this connection between overweight and incomes, the healthcare system, same as in France.
And just so you know, you are not excluded from this conversation. So if anyone wants to jump in and have a question, please just holler. Yes, sir.
The question is sugar addictive? When we put sugar in products, does it make us want to crave those products?
Is sugar addictive?
So let me give you some of the basic, the answer to the question. You have to give me the definition of addiction. What I can say is, with your colleagues, with Diane Latterman and Jeff Grimm, if you look, we published a paper that's called Deconstructing the Vanilla Milkshake. Right? Not the typical scientific title, but Adam did work, back in the 80s and 90s. But if you ask the question, what will an animal work most for?
It's not sex?
Chocolate.
No, look at you.
What will an animal work for? What will they press a lever? So how do you test whether something, if you're NIDA or DEA or FDA, how do you decide whether to list a molecule, a drug, as a controlled substance, right? And you do what's called self-administration tests. And it depends on how hard the animal will work. So what you do is when you get sugar, fat, flavor, you have an animal, you press the lever once, you give him the food, then you make him press it twice, right? And then you make him press it, you do it variable ratios, you do it 4 times and then 16 times and 32 times, and you'll see how hard they'll work for, right? So you'll see what the break point is. Are you willing to press that lever 64 times before you get that pellet of sugar or fat or flavor? What do you think? We can take a vote. How many think that the major driver in the vanilla milkshake is sugar? Raise your hands. How many think it's fat? Raise your hands. How many think it's flavor? The major driver is sugar. If you look at the variable ratio tests, you see that sugar is the main driver, but when you add fat, it is synergistic on the fixed ratios. Now let me give you the second. Gaetano De Chiaro is one of the great pharmacologists who studies cocaine and studies amphetamine. And what he sees is amphetamine and cocaine gives you elevated activation of the dopamine circuits. Right? And you don't get habituation. So every time you give amphetamine and cocaine, you see this elevation in dopamine the first time, the second time, the third time. Traditionally, if you look at the literature, food gives you a little bump in dopamine, but then you habituate. Right? The second time you don't get the bump, the third time you don't get a bump. The fact is, if you give sugar and fat to these animals, you get a very significant rise in dopamine, and you don't habituate. Let's understand what addiction is, okay? And in some ways, food was the first addiction, right? Food, and sex. That was, and everything else hijacks those pathways. But understand what we're talking about. We're all wired to focus on the most salient stimuli in our environment. Mm-hmm. What do I mean? If a bear walked in right now, you'd stop listening to us and you would focus on the bear, right? That's the most salient stimuli. If a building's burning, when that 747 buzzed New York, everyone's dopamine level, that was the most salient stimuli. It could be alcohol, gambling, sex, nicotine. They're all salient stimuli to some people. For many people, food has become the most salient stimuli, and fat, sugar, and salt, right, are at its core. When does it become addictive? I mean, if you look at the WHO, if you look at the Surgeon Generals, right, it's it's when it starts knowing that you don't want to do it, you have this compulsion to do it anyway. And there's a psychopharmacology. Those are the scientific definitions of.
Let me supplement that. David is absolutely right, and rats will bar press for chocolate. They will not bar press for shredded carrots or lettuce, which is actually an interesting sideline in our school nutrition policies. We're trying to take chocolate away and carrots and lettuce. But liking and preference, to my mind, does not mean addiction. To me, sugar is addictive in the same way that cheap mortgages are addictive.
Could I stop you guys for a second, though? Because I'd like to redefine. My idea of sugar in the 50s was a teaspoon of sugar, which was 16 calories. Now sugar is hyper-sweet supplements and corn syrup. So are we talking really sugar, or are we talking sweet stuff?
You're talking of sweetness. Right. It's the sweetness that is the salient stimuli. Now, it's not liking. The difference between a person who is thin and a person who there's no change in liking. The difference, what you have to measure, is wanting. There is a difference in how much you want the food, how much you think you need the food. Right? The problem we have in our society is everybody wants to be thin. Not everybody, but a lot of people want to be thin. So you focus, all right, I want to be thin, I don't want to be fat. That's what you focus on. But then you look at the food and say, I want that food. Mm-hmm. And I need that. But I want to be thin. So of course you're living in torment. Until you focus and change the relationship with food, I mean, you're never going to get a handle on
Kate.
Oh, sorry. Yes, that question. I read an article that U.S. manufacturers of breakfast cereal sold in Europe have considerably less sugar than the same exact brand sold in America. So the question may be, do I put more sugar? It becomes a little more addictive, and therefore I sell more and I make more. And we're the pawns of cereal manufacturers.
Yes, I think you just channeled what I was going to say. It goes back to our farm policies again. We subsidize in this country #2 corn, which you can't just eat off the cob. You have to turn it into something else, and we largely turn it into high fructose corn syrup, and soy, which we turn into fat. Those are the two things that our tax dollars go to subsidizing. It's not going to Joe Farmer down the street who's growing broccoli and strawberries and everything else. It's going to agribusiness. Agribusiness turns around, uses those products to make this cheap, and I won't even call it food, quote-unquote food, that we're talking about becoming addicted to. That's the problem. Until we fix that. And it's unfortunate because the Farm Bill just passed again last year, so now we've got to wait 4 more years. But I'm hoping that all of you go and now have an awareness of this policy and call your congressmen and your senators. This has got to change. Until this changes, we're going to be having panels up here, like Nancy said, talking to ourselves until everybody's fat and dies. I mean, basically, that's what's going to happen.
So the secret to that, then, is campaign finance reform.
Yes, exactly. We were talking
so we're back to that again.
Yeah.
That was the same conclusion in the health reform session.
Ron, go ahead, and then...
Yeah, so I just wanted to say that maybe, I don't necessarily think we're going to solve all the political solutions to solve this, but I will throw out another idea that's actually floating around the biotech community, which is now we actually know a lot about the biochemistry and sensing of taste. We have taste receptors that have been cloned, and we know the proteins and what the different taste receptors are wired to in the brain. And there actually are biotech companies that are looking at this as a new opportunity to modify behaviors in a way, to make things that would be perceived as tasting more palatable.
Yeah, but intense sweeteners, which provide sweetness without calories, have in themselves been blamed for the obesity epidemic, so you can't win.
Well,
why have they been blamed? There's no data for that.
Pavlovian conditioning. You are conditioned to sugar, calories don't come, your metabolic system gets deregulated, you become obese.
Wasn't that the whole Diet Coke, it leads to obesity because it makes you crave more sweets, and although it's counterintuitive that it jiggers the desire for other stuff.
Doesn't really make sense.
Well,
I think if we if Coca-Cola would come to the table and be a stakeholder and say they're not going to sell Coke, they're only going to sell Coke Zero and Diet Coke, I think that would help quite a bit, because the consumption of carbonated beverages between 1958 and the present has gone up 22-fold. And if we could take the calories out of that, it wouldn't be quite so bad.
But understand, it's not just the sugar or the sweetener. Understand. Take Coca-Cola. What is it? The issue, and again, we have to be a little careful. On the use of the word addiction. Right? And let's go beyond. Let's go a little deeper. The notion is we're making food more multi-sensory. If you really look at Coca-Cola, it's not the sugar alone. It's the sugar, the sweetness, the carbonation, right? The temperature, the caffeine, the mild pharmacological effect, the glycerol, in the mouthfeel. So you're getting a multi-sensory experience. We used to go in and we used to go have ice cream, right? And you'd have, 3 flavors of ice cream. So just look at how ice cream has changed. So now you go into an ice cream place and you have ice cream with what in it, right? You have gummy worms or cookie dough or this or that. What we have done, right, is made food, and the industry understands this. They understand the roller coaster in the mouth. They understand the sensory aspects of that. They understand the getaway. Food we're eating today, the average, 20 years ago, when we were growing up, you chewed on the average 20 to 30 times per bite.
Really?
Right. Today you're chewing half of that. So, and food is designed so it doesn't linger. So you get the sensory hit, it's gone. And why do you reach? And then you reach for it again because it doesn't linger in the mouth. The problem, one of the problems we have, is that much of what we're eating is not real food. I agree with you that much of the processing was originally designed to have uniformity across the country. But in that processing, we have taken out anything that slows down eating, that lingers in the mouth, anything that is at all, offensive, right? Any fiber or whatever is out. We're all eating most of the time, the equivalent of adult baby food.
I agree with that, and I think that's a very interesting point. We've processed our food to take out the nutrients, and it's nothing but calories, and it again goes back to the economic issues. Now, there's an interesting finding, and that is this. We've all looked for a connection between overeating and overweight. We always say overweight people must be overeating calories. We've looked in every single data set that exists, and it's not there. So we say obese people underreport, there must be some underreporting, they don't tell us the truth, maybe they don't exercise. But the fact is, epidemiological data do not show you a clear connection between overeating and overweight. Sad but true. Where there is a connection is between nutrient density of the diet and low body weight, which means that the more nutrients you pack per calorie, the slimmer you are. And that diet is not a sugar diet because that's empty calories, no nutrients. And that diet does not necessarily taste better because many of the nutrients are slightly bitter. The phytochemicals, bitter. The antioxidants, bitter. It's a more savory type diet. I'm not talking salt. It's a different, more interesting diet. It's not a sugar diet, but that diet is actually correlated with being slim. Nutrient density, not so much calories. Very interesting.
But calories have to be there, Adam.
That's what we all believe.
During the period of weight gain.
I agree completely.
If you study people at steady state and compare to non-overweight, you do not find a difference because they've adapted. But during the period of weight accretion, there had to be more calories. It would not have happened.
I agree. If you look at the better studies, Adam, there is no question that there are additional calories. We've done people a disservice in this country because we've told them that there is a constant belief still, right, that it's metabolism, I metabolize differently, and I eat the same.
Yes.
Okay? There is perhaps, an 8-10% variation in metabolism can affect weight. But the majority of that weight is calories in, and for Jim's here, also calories out.
Ron,
it has to be that.
Ron and then Kate, and then we're going to let this gentleman ask a question.
Yeah, I think we shouldn't delude ourselves that it's a caloric balance because there's got to be caloric balance. I actually tend to disagree with you, Adam, on this point because I think actually if you look at calorie consumption where you just take the gross food consumption and you divide all of those calories by the population base, actually we are consuming more calories than we have gained weight. That is both true for Europe and for the U.S. The average caloric consumption has gone up enough that we should have even gained more weight. And I think the body's homeostatic mechanism actually has tried to increase some of that caloric burning, but we're not doing it enough. And I think that this is true also in underdeveloped countries relatively, because they started at such a low baseline that as they go up about 100 calories per decade in terms of their average food intake, it's having a greater impact because it's a greater percentage.
No, I agree with you. I'm not saying that calories don't matter. Of course they do. Otherwise, we would be contravening the laws of thermodynamics. I'm saying for whatever reason, if you want to lose weight, eat nutrient-rich.
Kate?
Yeah, following up on that very comment, which is what I wanted to mention, something that a 15-year-old told me about 4 years ago when I was asking him why he ate in a fast food restaurant 2 or 3 meals a day, and this child was obese, was because I think what Adam is talking about. He said he is always eating there because he's done and he feels full at the same time. I get finished eating a supersized me or whatever he said meal, and I'm still hungry, but I still feel full. And I don't understand that. So then I eat more. And I want to go back. And I think
this is a huge issue. We are out eating our satiety signals where we feel full.
Wait a second. It's
I promise I'm coming to you.
It's not clear to me, and I know this is heresy in the scientific community, that there are satiety signals. Right? If they exist, and let's CCK, let's assume that they are very weak.
Yes.
Right? We have overridden. I mean, this morning I just gave. If you look at that 2-year-old, the 2-year-old compensates. You give that 2-year-old more calories at lunch. They will eat fewer calories later on in the day. By the time that 2-year-old is 5, after exposure to the American diet, they lose the ability to compensate. Right? So they're eating for reward. Their brain is being activated. It certainly overrides whatever satiety signals there are. If you tell me to stop when I'm full, I'm never going to be full. If you tell me to eat only when I'm hungry, I feel hungry all the time. That's the problem with that kid. Because that kid's brain, that kid's brain has just been constantly activated, bombarded. Right?
Well, it's sort of the cocaine model then, isn't it?
It is there's no question that it's the same circuits, Nancy, as cocaine or alcohol, or gambling. Cocaine may go to a different receptor. The route of administration is going to be different, but it's the exact same neural circuits. And when that amygdala is lit up, and it doesn't. That kid, we can't bring the fMRI into McDonald's, but you can bring the kid into the fMRI. As long as the food is in front of that child, both the cues and the food, as long as that child is being cued or eating, right? Those brain reward parts of the brain remain activated and don't shut off until all the food is gone.
And
yes,
all
sir.
the messaging about food,
Right.
not just the food.
Yes, exactly right.
My question is diet, and this discussion is global diet. I find it very confusing in the sense is the ideal diet. I know some people that are vegetarians. I know some that do the food combining. You can't have protein with carbohydrates.
We know some people who eat whatever they want and they exercise and it burns off the calories.
Some people just eat rice, and which has no nutrition. But yet, is there...
You wrote your book deals. Magic in this. The problem is it's just so follow it.
Right.
Are you talking about a diet for healthy people? Or are you talking, or a diet for
Food.
Real food.
Food, raw whole foods. You can cook them and process them yourselves, but I work with in school districts, as I said, and hospitals and other institutions, and I work with a lot of nutritionists. And the minute one of them tells me we need to teach children how to read labels, I say we need to teach children that if it has a label, they shouldn't put it in their mouth, because at that point it's processed and then it has added sugar and added salt and added fat, and those are the problems.
So when you put the salad dressing on the raw vegetables, are you ruining it?
No, you're adding calories.
Yeah, you're adding
Right.
calories and
Wait,
sugar and.
Let me just press you. Okay, was that for? Do you really believe you don't teach kids to read the label?
I don't. I do think that they live in a world where they're surrounded by labels and we need to teach them how to read it. But my preference would be that we teach them first. If it has a label, it's probably not food. You know, when you teach them where food comes from, food does not grow.
It's tragic.
Food does not come with labels.
Well, let me put it a different way, because what you really want to do is to count up the ratio of beneficial nutrients to encourage, relative to calories. The label helps you, but you might as well integrate that and know which foods are the ones you ought to eat. As long as that ratio is favorable, you're fine.
Jim?
Well, I'm often confronted with this question, not so much for what's the diet people ordinarily, but for what diet should you use to lose weight. And people argue low carb, low fat, high carb. I don't think it matters what you leave in. It's what you take out of the diet that is the crucial thing. And if you reduce the caloric load substantially, you'll lose weight no matter what you leave in.
It goes back to the basic equation. If you want to lose weight, it's calories in, calories out.
got
But you
it.
can
That's the
be
bottom line.
obese and nutrient poor, and you can be skinny and nutrient poor, or you can be sort of normal-bodied and have what you need.
If you eliminate foods that are just high in sugar alone, high in fat and sugar, high in fat and salt, high in fat, sugar, and salt, and you try to eat real food, that probably is the optimal diet.
That makes sense. Jim?
Okay, you've depressed the hell out of us now with the problem. I want to press you a little bit on the solution side, but I want to preface that with a brief comment. Clearly in this country, obesity is higher in the lower income people. But if you look at by income or by education, the increase is the same. So we aren't even stopping obesity in rich people. You look at states, Colorado's the leanest state. We've increased right at the national average over the last few years. Mississippi's the fattest state. We can't even do it in Colorado. So given that, you've got 6 smart people up there. We've just heard that we've got maybe 20, 30 years before we're all obese. What do you propose? Seriously, what do you think it's going to take to solve this problem?
Well, as moderator, I'll stick my neck out and say the correct thing of the day. I don't think it's fixable. I think we're hosed. I really do. I know. It's a pretty lousy statement for me, isn't it? I know.
All right. So let's take
It's
that.
tragic.
So let's take that as for granted. Let's say you're right. Okay. But let's say you're right. Now the question is, what are you going to do about it?
Oh.
You have no idea.
That's why I'm the moderator.
No,
look.
No. Hold on a second. Wait.
No. Do I think you stop trying? Absolutely not. But here's the problem. I think we are looking at the perfect storm of a society part. I really do. I think we are looking at school systems whose budgets have been raped and there's no physical education. I think you're looking at neighborhood clubs that aren't open anymore and mothers are afraid to let their kids run the streets like we all got to when we were growing up. I think you're looking at nutrient-poor, calorie-rich, junk food. We have failed to make farmers with sustainable agriculture really link our local farmers into our schools. And, you can go back to government and everything else. I really think this is a multi-system, clear the table, start over approach.
So let's
with
say
the federal government taking a leadership role.
So you're right. So what's so hard about what you just said? Why is with the stakes so high?
So why doesn't Washington, D.C. work then?
Because we have to reform campaign finance again.
I'm serious.
No. I mean, it is doable.
Right,
right?
so let me take it one step
it's not
further.
going to be political fun, right? You're not going to. I mean, you're going to have a problem with the food industry.
And the pharmaceutical.
Let me make it even a little more politically incorrect. All right,
What's politically
well, I'm going
incorrect
to make it really politically incorrect right now. Our Surgeon General nominee is overweight. She's black.
Whoa.
No. You got to listen. Let me finish.
Okay.
So what now is the role of the government to say, we are going to have a President's Council on Physical Fitness. We have a Surgeon General who's going to say, I get it, and I'm going to lead you out of this, and I'm going to help spearhead reform in Washington because I've watched every family member in my die. and I get it more than anybody else. So watch us. We feel the nation's
doable.
pain. We're going to fix it.
It's absolutely doable.
Do you think it'll happen?
So I
I think it can happen.
See, because I think this is part of the problem.
I do think it can happen because there's no one better. I mean, people who are big, the majority of them don't want to be big. Some do,
I get that.
right? And they understand the torment, right? And it's a question of leadership. It's very, very hard. You're dealing, if this is your word, cocaine, or someone else's word, this is addiction. I've stayed with conditioned and driven behavior, right? But if that's the case, that's a very powerful forces on the other side. Add to that the food industry. But it's the wiring in our brain and our environment. But we did it with tobacco. You would have never thought.
We taxed the hell out of tobacco to make it work.
But,
There were a lot of stuff that we did with tobacco.
it's more than the food industry, David. The British.
What?
So can I?
And Cuban cigars don't count.
Don't count.
But let me just say, I don't think that this notion that it's completely a government or a think tank institute's job to solve this. And I think that the missing from this discussion at this table, and at most of the tables in this whole meeting for the last 3 days, is any real representation from the food industry to try to get them involved. Now, there have been a couple of people. There are a couple. But I think that's not, and there's the restaurant, there's the food purveyors, there's the food marketers, there's all levels of this. This has got to take a cooperative, you're right, it is a huge challenge. And I think that unless we change fundamentally the notion of the way food is dispensed, and not everybody's going to go to their whole foods market and buy fresh food all the time, we're going to have to try to get the food purveyors who make a lot of packaged food to be on our team to try to make packaged foods that are more healthy.
It's way bigger than that. The British, to give them credit, came up with a report on obesity in the UK, and they asked a very provocative question, talk about being politically incorrect. Is becoming obese a necessary consequence of living in a Great Britain of today? And if so, what about the Great Britain of today needs to be fixed? This is not a question that anybody has dared ask in Washington. And they said, yes, the food industry is involved, but so is transportation and health and aging and education and everybody else. And there is an intra-governmental task force which is supposed to bring all the government ministries to the table. And we have not seen that here. And if we see something like that here, then yes, there is hope. If we consider obesity to be either a problem of health, more hospitals, or the problem of the food industry alone, nothing's going to happen. It's way bigger than that, and everyone needs to come to the table.
Well, what if we turned the question upside down and we said, who cares? So we're a heavy nation. We have all the bioscience, the smart people who make drugs. Let's get fat, take your Lipitor, take your insulin, your brain's still fine, go on. Let's get over it.
No, but your brain
You'll
won't
have
be
devastated
fine,
states
and
like
your heart
Michigan.
won't be fine, and your eyes won't be fine, and you're going to have all the consequences.
Then you're supposed to fix it because you're a smart scientist.
Yeah, but we're not going to be able to fix it. We need to prevent it. It's too costly to fix it. It's going to ruin our society.
And
We're going to ruin our world competitiveness. We've got to do it at a preventative way, and we've got to really take the whole combined kind of approach that Adam is pointing out that they did in the UK. And we've got to get all the players at one table,
Yes,
all
ma'am.
the stakeholders.
I just have a quick question. Are there any foods, natural foods that are out there that stimulate the same reaction as, cheeseburgers and stuff like that? Like, have you seen in any of your research that there are any real foods that,
broccoli
get the
beef
like it
cheeseburger?
can? Is there some natural
Cheese.
food out there that's just great that people go crazy about?
Cheese, beef, fat, salt.
No
But you can
fruits
eat it and still be
vegetables.
healthy.
Yes, that's the whole point.
Yeah.
The issue, it wasn't that hard to control this problem in the 50s and 60s, or the 30s or 40s or 50s or 60s. We knew how to do it back then. We've only screwed this up in the last 3 decades. So what were we doing back then that worked? Not that we can go back there. I understand that.
Well, why can't we go back?
Well, because Ozzie and Harriet don't exist anymore, right? And the world was different back then. But there was stuff that we were doing back then that worked. right? Our food environment was very different, right?
Yes.
If you look at our communities today, gas stations, every corner.
But I'll tell you one major thing that was different. One major thing was that one salary, one wage could support a whole family. We had a manufacturing economy, not a service economy, and we had a manufacturing economy with full benefits and healthcare, which we no longer do. So the shift from a manufacturing economy to a service economy devastated the family meal, and the wages have been stagnant for the past 25 years.
We ate also at meals. We didn't snack all the time.
We had sit-down family dinners,
Because
most
we
people.
had very different
We had recess in
agricultural
schools.
subsidy
We had
policies.
after-school play. We were more physically active.
Your mother
We walked
kicked you out
to
of the
school.
house on a Saturday.
But the difference in the food system is we had a very different agricultural subsidy system until Earl Butz became Secretary of Agriculture. It changed in 1970 when we started to pay people to grow more, when we started to pay them to grow more corn and more soy, and a couple other things, but those are the problem children. That's what changed. And the effect of that was hit at about 1980 when they created high fructose corn syrup. And when you track the use of high fructose corn syrup in our food supply with the rates of obesity, those things go like this. And so what's the simple thing? I keep going back to that. Until we change, I agree with you. I think it's hopeless unless we can change that and change it tomorrow.
Which means a federal level change with the
Yes.
farm program and subsidies.
Yes, because that's what's creating all of this fast, cheap food that we find in the drive-thrus, in the gas stations, everywhere. It's ubiquitous.
But that's all fixable. That's all fixable with policy and changing social attitudes. It just requires a degree of effort that makes anything we've done in public health, seem really
we have to
mild.
start choosing human health over profits.
Hi, I'm a researcher in Washington, D.C. at Children's National Medical Center, and I think people have alluded to this a little bit in saying that you're kind of preaching to the choir at this forum. But I think it begs the question of the people missing from the discussion are overweight or obese individuals. And what are they really, what would they be, how would they be commenting in this forum? Specifically, I run a study where we look at genetic risk factors for metabolic syndrome among African American young adults, primarily freshmen at Howard University, which is a historically black college. And I will have to say that one of the great aspects of our study is that we provide health education. So after we do all this testing, we actually provide them back some results. And it's amazing how much, I probably didn't know when I was 18 either, what they don't know. You have to have a physical to get into college, but they don't know what their physical really meant. Nothing's explained to them about their lipids or good cholesterol, bad cholesterol. And the other thing is, particularly in this community, what is your concept of obesity? What is your concept of being overweight? You mentioned that the Surgeon General is an African-American woman who's overweight, and at Howard, the ratio of females to males is like 7-to-1. And so we get these girls in that have, waist to hip ratios that are above normal. But am I to tell them that, maybe BMI, is borderline, or maybe it is overweight, but a BMI doesn't mean anything to them, and it doesn't mean anything to their parents. And so to some degree, the discussion really needs to speak to what is actually tangible to the patient population you're trying to reach. And right now, what I find in this group, which, we spoke about economics and obesity taking away the future of our country. College-bound kids or people who are college educated are the leaders of the future. So we're talking about a group of people who are, specifically speak to all the things that have been mentioned. They come from all different socioeconomic groups. They're, in college in a kind of somewhat uniform environment. They have the same food options in front of them. So the question becomes, how do you make it tangible to them, this future leaders, that BMI means anything?
I'll start with you guys. Go ahead.
Well, BMI is interesting. When Ron and I were medical students and young house officers, we didn't calculate BMI routinely. We had life insurance company tables that projected for your height what should your weight be, and then people knew what their height was, they knew what their weight was, and they could look at that and say, okay, I'm more pounds than that should be. With BMI, we sort of obscured that because you got to go do a calculator to figure out whether you're one number or another, and you're higher than that. Maybe we've made the system too complex in using BMI. And I like what Mehmet did up here the other day, where he said, your waist should be no more than half your height. That's actually a number people can understand too. I think we got to get down to numbers that people can understand, rather than a concept of a BMI, which is too difficult for them to put their fingers around.
Yeah, and I would certainly agree with a lot of the comments you made, that there really are also big ethnic differences in not just languages and social backgrounds, but really in activities. I mean, we have a specialized clinic for Asian Americans with diabetes and Latino Americans with diabetes, and you can't just tell them, to go out jogging. I mean, that isn't, the activity. You have to be, appropriate for what it'll be. So I think that one of the things that the kind of work you're doing, and we really need to take this more in account, really needs to be to ask, as we get into each population group, what will be the most effective approach. Because ultimately we know what needs to be done. We need to reduce the intake against the output so that people will be leaner. And as Jay pointed out, all of the studies looking at low-fat, low-carbohydrate diets show that there's really not one diet that is substantially better than the other. It's only what people can stick to that's better than the other. So I think that we need to take into account the individual at this level if we're going to make really any inroads in this problem.
Yes, sir. Your microphone's coming to you.
I think all the talk about the farm subsidies is important, but I think a bigger part of the issue is what Dr. Kessler has been saying all along, the fact that the fat and the sugar are on every corner. I like to talk about this. In New York City, the McDonald's doesn't have enough room to have a drive-through, so we have walk-up windows. In case you're too lazy to walk inside the McDonald's and get your Big Mac, you can just get it at a counter on the street. And I would challenge you all to think about, in the context of sort of American and increasingly the industrialized world notions of freedom and freedom of choice, how it is that we reverse that trend. What are the laws? Are we going to create, could you imagine, are we going to create fast food zones? Is our society going to tolerate fast food restaurants only being allowed every 20 miles in densely populated areas? And what restrictions on freedom of choice that would reverse this trend of ever-present calorie-dense food can you imagine, or would you propose?
I think that urban areas do not use their zoning powers as strictly as they should.
You're serious?
Oh, yes. And I think your own city that I happen to share with you, New York is a good example. If I walk down 125th Street in Harlem, it's fast food after the next. And then there's a big girl shop, right? Then there's the overweight people's clothing shop, and then there's more fast food. And you see that repeatedly. It doesn't have to be that way. And if instead there were the grocery stores that we talked about in this morning's panel, that took, I think, years and years to actually get in place for lots of reasons, that might help some of this problem. But I honestly think that this is a national problem now, and it has to be dealt with at every level of government, because personal choice, as these two gentlemen have pointed out, isn't working. I mean, we have all of these choices in front of us constantly. We're bombarded with them by marketing, by zoning, by everything else. And until the government decides that it's in the nation's best interest, until it's in our interest to value human health over profits, this is not something that every individual can take on. I think somebody said at some point, one doctor or maybe more doctors, said that once somebody reaches the level of obese, it's almost impossible to reverse. Well, now we've got a huge population of obese. So how do we reverse it on an individual basis? I'm not sure we can.
The food industry will argue, and it's also implicit in the question of choice, that all they're doing is giving consumers what they want. That's the nature of their business, right? The fact is, we know more today. We know what they're giving them is activating their brains, it's cueing them, and it's setting off thoughts of wanting. I mean, if that food is not out there, I mean, if you didn't see it, I mean, the reason you're reaching for it is because you're cued. I mean, next time you're hungry, there's always a cue. It may be time of day, it may be a thought, it may be a location, but there's always a cue. Right? And that's activating the brains, certainly of adults, and adults can choose, but it's also activating the brains of kids. Right? So the issue of choice, right, and what you control and what you don't, especially when it comes to kids, and you're dealing with stimuli that are inherently very reinforcing, that have, as we see, very significant consequences. This notion we're just giving consumers what they want, we now know more. The first thing, I think, is to give consumers information of what's happening to them, why it's so hard to control them, and why they're having such a hard time eating. I mean, that's why I spent the last 7 years. And then you got to give them tools that work. If we're as negative, I mean, the worst thing that we can do is to tell people, sorry, once you're overweight, there's nothing you can do. It's gone. Forget it. Right? Because there is, when you're dealing with reinforcing stimuli, this self-efficacy, I mean, it's complicated, but if you don't have confidence in your own ability to do it when you get cued, you're not going to be able to calm the anxiety.
Well, I would say it all depends. I would say, well, without being ungracious, because it was delicious, our lunch today was barbecued ribs and fried chicken. Did it set up any expectancies in your brain? Are you becoming obese? Do you want more? Did you go after the fried chicken for an ice cream dessert? I did. I feel fine. Had I been living in Harlem and had nothing but this for 20 years, I would have been obese. In Aspen, no. So it really does depend on the context.
Let's talk about the class warfare. And I'm using warfare because I can't think of any other word that it's not really quite the right word.
It is the right word.
It is the right word. If I'm a mother in the Bronx and I'm holding down 2 jobs, the reality is I can, and I'm very cognizant of the fact that Deborah's sitting in this audience and she's taking a beating this weekend representing McDonald's. She's taking a beating. I can go buy 4 hamburgers and give my child nutrition cheaper than I can if I go get the ground round and the bread and the pickles and go home and do it. I mean, there is a cost aspect to this.
You're absolutely correct. And this is, in fact, the only economic decision people can make. And in fact, when we programmed computers to take cost of food into account, which no one who does dietary guidelines ever does, the computers made the same exact choices that low-income people do. Driven by cost, you go towards cheap, convenient foods. So yes, this is the only decision that you as a working mother in the Bronx or Harlem can make, and that is in fact on economic grounds a justifiable decision, and it's not a bad one, let's face it. So it all does depend on context. So my point is, to continue your issue of class warfare, that yes, obesity is a class issue, and it deserves at long last some class rage.
You actually believe the French fries are giving nutrition?
I didn't say French fries. I had said hamburger.
Hold on, French fries do have potassium and fiber and vitamin C.
And how do they contribute to satiation? Do you end up
by 500 calories? Plenty,
but is it just stimulating you and your what pathways to eat more and more?
But I would argue that we should get all of the purveyors of food, McDonald's and everyone else at the table, and say, how do we go about getting 10% of the salt, 10% of the calories, and 10% of the fat out of the portions, and leaving the portions to be satisfying for people without having so much in it. If we could reduce it all by 10%, we would begin to make progress.
Yes.
Right.
But how are you going to get it out of every corner? We're eating constantly throughout the day.
Well, we have to retrain and educate people that you only eat 3 times a day. We need a massive education program. The same way we did that on cigarettes, that cigarette smoking is dangerous for your health. We have to say that eating more than at meal times is dangerous for your health. We have to reconvey how we present things to people and go on a massive education program. We've got to get people in the industry cooperating to reduce some of the content. And we've got to really be thinking about this as a society on a broad-based way. If we do that, I believe we can make progress.
That's a very interesting point.
We need to get the industry to modify their marketing strategies as well. Not just what's in their products. But when I go home to New York and I see every taxi and every subway and everything with a Snickers campaign, and it's a really great ad campaign, it makes me buy Snickers bars. on a much more regular basis. And that's a big problem. That's something else that we need to address.
The 800-pound gorilla in this room, and that is, we're talking about class warfare, and we're talking about obesity, and we've got 6 white folks sitting on a stage. It's inherently wrong. I mean, the conversation is, I think this is part of it. How do we broaden this to have different people at the table to hear things differently and to change the conversation? Someone in the back had a question. Deborah, go ahead.
Couple things. As I said earlier this morning in a session, McDonald's to be a part of the solution, and I think it's important that everyone understand that. It is also, along with the food industry, along with how we cook and serve at home, it is also, along with all of our eating habits, part of the problem. So when I hear these oversimplistic, get rid of this and get rid of that, I'm not really sure that would give you a solution to what we're talking about here. There would be a lot of hungry children in Harlem if you didn't have a McDonald's or if you didn't have some of the food. It's just the truth. So I think in keeping with your concept of dialoguing, I do think you need to get the food companies around the table. They themselves are around a table talking about this same thing. What can we do? So the willingness is there. But I think that I think it's important that there's the spirit of cooperation and that there is an objective use of data and a pretty logical, reasonable approach to how do we solve this, as opposed to trying to basically demonize foods or ban foods, ban ingredients. I'm just not sure that's going to work. I've never seen it work in the past with other substances.
And with that, I'm going to ask you to pass the microphone to the woman behind you, and then...
Well, thank you. I'm very hopeful that we can have a solution. We have such leadership in this field right now. There's been a whole sea change, and we have a friend of mine was saying it's our counselor-in-chief, is our president-in-chief. He comes out every day and educates us to take an integrated look at solutions. And it is an integrated approach we're going to need from the food people and the farm policy and educational systems, but very educational. What is the state of our culture right now, and how do we move it in to a healthier
Are you
economy?
hopeful in the state of our culture?
Yes, I see signs that we're cross-pollinating communication just like we're doing here. And I'd love to collaborate. I'm a social architect and media producer with other organizations here to help present an integrated platform to help solve the healthcare and food issues in America on all levels. I think there's been enough brain power coming and heart power. We heard from Goldie and Deepak this morning that we could be that think tank and come out with some integrated initiatives from this that we can all contribute and act on and take forward in our own way to make this administration's success sooner rather than later and save more lives in the process.
And as we pass the microphone up to... I'd like to just see a show of hands. How many people are hopeful that this is fixable? How many people think it's fruitless or not so hopeful? Okay. And that's why it's the United States of America, because we're very hopeful people. Yes, and I'm going to let you, and then the gentleman in the back.
I was going to make another comment, just going back again to the patient, is that that sometimes for a morbidly obese person, the most positive attention they get is when they are going in for surgery. Or comprehensive attention, because there's like a whole multidisciplinary, you have to have psychiatry, you have to have nutrition, all those things in order to...
So where's that safety net beforehand?
Right, and then after, because they have to maintain,
right.
A healthy lifestyle afterwards. And so where is everyone before that? And so I think part of it, if we go back to this whole concept of health reform and the physician doesn't necessarily have the time for counseling, whether it's a pediatrician or a general internist. And so the attention to the overweight or potentially obese individual is not there beforehand until after, and they get all this attention, they learn all this information, and now, it's positive, but it's surgery as opposed to more of a preventative nature. Where's the reimbursement for nutritionists being on board is not necessarily
here
there.
The issue is what's reimburse healthcare in the United States, where we pay for a procedure-based thing, and these surgical procedures are $40,000, and as part of that global fee, they can afford to provide the behavioral and nutritional support that they need to make that happen, because the surgeon isn't the least bit interested in talking to the patient, so he or she gets the other team members to do it, and we're reimbursing it because it's a procedure. And I'm sorry that I've got a surgeon sitting next to me who might not agree with that.
But you are right.
But I think we need to stop reimbursing for procedures, and we need to be developing networks of healthcare where we're paying up front and we provide preventative services and not procedure-based approach. And we're going to hear that in the next hour, which is coming up.
And to some extent, the medical model deals with intervention and treatment, and the obese patient could be, in theory, coming at you from any place. You don't know until they get to you. But in fact, we know pretty much exactly where the obese person is coming from, which neighborhood, which area, which zip code, which county. New York City has got terrific data on exactly where the obese patients are, where the prospective patients will be coming from, and they're actually targeting interventions in those areas. And the medical system nationwide has not done that. The patient has no history until they got here to you today. But in fact, there is a 20-year history of bad diets and living in poor neighborhoods, which ought to be taken into account.
So I'd like to, as we wrap up this session, start with you, Adam, and David, and then come back. Since this panel is hopeful and the audience is hopeful that it's fixable, but one thing, if you really had the policy power in Washington tomorrow to fix one thing that you thought could set us back on the right track, what would it be?
That's the problem. There is no one thing. You've got to fix
I'll
everything.
give you three things.
Give him two, he'll take three.
Governmental agency to deal with issues of health and prevention.
Does this mean beef up the FDA?
Probably have an institution parallel to the NIH, which deals with treatment and very effectively, but deal with prevention and involve FDA and agriculture because they are really in charge of our food supply, but also bring in transportation, education, and the others. In other words, the British model.
Interesting. David, since you were in charge of the FDA under two administrations, can the FDA do anything?
FDA can be a part of it, a very significant, probably bigger than anything we've seen, campaign that has within it all the aspects of greater disclosure of what's in food, greater education of people, dealing with school lunches, dealing with vending machines, dealing with farm subsidies. I think you have to change. In the end, government is just a tool. The real question is how we perceive food and what we want, and you got to change what America wants.
And are you hopeful?
I think it's bigger than we realize. I think it's harder than we realize. I think it is. We've seen it done on a modest scale with tobacco. It can be done with food. We've not yet demonstrated the political will to do it, but it is doable.
Kate?
It's no surprise I would change the way we subsidize agriculture in this country. I think that would result in a truer cost of the convenience foods that so many of us consume and that these populations that Adam's been describing consume on a daily basis. And one thing we haven't talked about here is we're raising a third generation of Americans who don't know how to cook. And I would redirect some of that money into training all the way down to parents, not only institutional cooks, which is something I do regularly personally, but mothers and fathers, how to cook again. I think that would also fix some of this.
Ron?
So a number of the ideas that have been mentioned, I think I would go along with, but I will add two thoughts to this mix. I mean, one is I do believe, as was already discussed earlier, that all components of the food industry need to be at the table as we discuss this to try to figure out, because they're very good at marketing. Look at everybody here drinking bottled water. Who needs bottled water? There's plenty of fine water running in this. They're very good at marketing a lot of things to us.
And it's not even out of a spring. That story broke last week.
So I think that we need to get them on our side, because if we all agree on things that would be healthier, I think the food industry could help us convince the public that this is actually healthier behavior. They're good at that. The second thing is, being a researcher, I would say, as I've had this discussion with some of the others on the panel offline, is I think that we're a little oversimplistic about the role of nutrients and non-nutrient things in what is in our food supply. And I actually think there may be things that are driving changing eating behaviors besides the high fructose corn syrup and other things that we really need to understand better so that we can learn to modify food so that our normal cues for balance will work normally. And I don't think it's just the processed foods that we've mentioned. There may be other things as well, and we're just not looking at them because we're so focused on a few processed types of foodstuffs.
Jay, I'll let you have the last word.
Well, they've said most of the things already. I particularly the importance of the public-private academic partnership with all the stakeholders at the table is crucial, and Aspen Institute is working to do that with the Nutrition Task Force. But if I had to do one other thing that hasn't been mentioned, I would bring back the President's program on physical fitness and mandate that there be physical fitness in schools from K through 12 throughout, and really encourage that. And we've got to get people more active. I think activity really needs to be a key part of this.
Yeah, and I really want to end on that because I think that's very important. We talk about the top-down leadership in Washington, D.C. I think this president and this Surgeon General have an extraordinary opportunity to change the dialogue in this country. Not only are they these two people of color with extraordinary brains, but we are looking at a nicotine addiction, and we're looking at a woman who's probably carrying too many extra pounds, and she's buried her entire family. What a wonderful opportunity to change the dialogue in this country to things that are affecting everyone. I think it may be the perfect moment, and I hope there's real, as you said, political will in Washington to really use the opportunity. I want to thank all of you. I know this kind of discussion has opened more wounds than it has solved problems, but that's why it's a forum. Thank you.